Hi, everyone, and welcome to another episode of Public Health Career Conversations. I am very happy to have with me today Dr. Geraldine Timothy. Geraldine is a public health medicine specialist, and she works in the role of Head of Quality of Care in Strategic Risk Management at Discovery Health in South Africa. Geraldine, thank you so much for taking the time to be with us today.
Thank you for having me.
Okay, great. So, as you know, the sort of rationale around some of these conversations is to help people who are interested in public health as a career to think through a bit more around what are some of the factors that other people have considered when choosing public health? What were some of the decisions that led them down this path? And so can we start there? Maybe if you can cast your mind back to, the beginning of your journey and really just reflect for us what drew you to public health? What did you have to take into consideration when you made that decision? And, sort of what was your journey around that?
Sure. So I think I'll start off by saying, as an undergrad, I never imagined I would become a public health specialist. It was far down my list of things that I wanted to aspire to become. Our grooming was very traditional. I think where we assumed clinical medicine was the be-all and end-all, and I think that's the main experience of many. My intern and community service years, I mean, not that we had some experience in an undergrad as well, but it's in those 2 years that I saw firsthand some of the problems in our health system. And as much as we tried on a day-to-day basis to get through the masses of patients, the problems that we faced in the healthcare system were still there. I then went across to the UK for a bit, and in that time, I had the opportunity to work in a few non-clinical jobs. One of the examples was Guy's Drug Research Unit. And this is where my actual awareness of non-clinical work started. I came back to SA after 3 years, and I found that in that time that I was away, the health problems or the solutions that we were working on were happening very slowly. So my desire to, how do I say, have an impact on healthcare was stronger than before I'd left to the UK. I was fortunate to have friends and ex-colleagues who were already in this field who guided my exploration of public health medicine. And I think the main thing was that I wanted to make a difference on patients' lives, not just by diagnosing and medicating and treating them individually, but by driving this kind of system change that would take into account other factors that I didn't feel we were factoring in our overwhelmed day-to-day clinical jobs. And this would be factors that public health medicine specialists are familiar with, such as social determinants of health, a lot of the inequalities that we face, and just various factors that influence how one's health journey turns out. It's not been an easy journey. I've often wondered if I would have been a more effective clinician. And early days as a registrar, I did try to keep some connections with the clinical world via locums. But I think if I look back now, and it's been many years, the ability to contribute and influence healthcare broadly has just been incredibly fulfilling. So that's, in a nutshell, how I've come to where I am today.
I think that's really a common reflection from many around the health system and feeling the need to address health in a broader manner. And so many colleagues have articulated that, having worked in the services, having seen, the broader, as you say, social determinants of health, and feeling, especially in a country like ours, that, just putting bandages on patients is really not helping the situation. So yeah, to anyone who's watching, that's not it. If that's the way you're feeling at the moment, it's not uncommon. That is how a lot of people in public health, got into the field. And as you say, it wasn't something that we were too exposed to in medical school. I think, medical school training is changing at the moment, but it didn't really, I think medical school didn't really prepare us for thinking, as you know, in a public health manner as clinicians, and sometimes also we just didn't have the time. So you knew that a patient needed XYZ, social interventions, but you were so overwhelmed that all you could do was refer them to the psychologist or the social worker, etc. And there really wasn't that time to engage with the deeper aspects of public health. So thanks for that. So once you made that decision, then what was the journey then? What did you end up training in, and what has your path been since then?
So in a nutshell, I joined Discovery immediately after qualifying. So it was my first job and I've been there ever since. It was circumstances at the time in terms of the availability of different roles. And when I look back on the time that I spent at Discovery, I have absolutely no regrets. And I actually see it as fortuitous that I managed to land the role quite early in my career and have grown within that space. Do you want me to tell you a little bit around what I'm doing at Discovery or just...
That would be great. Yeah, I think.
Okay, great.
Let me just say before you tell us, I think, and I was reflecting about this the other day because I did an interview, and I realized that a lot of people think that public health or public health medicine means public sector.
Mm.
And it doesn't, and that's why I was very happy when Geraldine agreed to have this conversation with me, because public health is really, if you think about it, population health, and it's where we look at the health system in its entirety, and part of that is the private sector. So it would be really great if you can, reflect a little bit more on your work and sort of how your public health medicine skills are brought into your role at the moment.
Sure. So before I get into what I currently do, just to add on to your comment, I must say, on qualifying as a public health specialist, and at the time when we looked for appropriate roles, I had friends and colleagues who, were like, you're a sellout. You're going to work for private, it shouldn't be where you take your training. And so I'm hoping that when I explain what I do, that people see that it's not actually true working for the private sector is actually selling out in terms of the training that we've done in terms of public health medicine. So I currently head up quality of care at Discovery Health. I wasn't hired specifically due to being a public health specialist, but my background and training definitely give me an advantage in executing the role. So similar to the public sector in SA, at Discovery, as Atiya mentioned, we look after a population of people. It's a far smaller population than the broader South African population. And our ultimate aim at Discovery is to make people healthier and to enhance and protect their lives. And I think that motto can be applied across all sectors of healthcare. The difference is we are looking after people that pay for the service and, they can afford private healthcare, but we still need to be prudent in terms of how decisions are made, how we ensure that the funding that's allocated is used responsibly, and that we do our utmost to drive the best quality of care, the best value. And in my terms, that's the best outcomes for the best cost, right? So I'm responsible for ensuring that services funded by DH are safe, that they are effective, that they are patient-centered, and it requires driving healthcare improvement. It requires a lot of interactions with providers and societies, building trust and good relationships. And then for the patient, and we refer to them as our members, it's about facilitating transparency. You wouldn't book a hotel currently without knowing, some sort of understanding of what you can expect from that hotel, right? We rely on some star ratings, for example. And for us, it's important for our members to know what are they buying into, or where are they going for these services, and what can they expect in terms of the care that they get. And that's so, in a nutshell, what I do. All of this that I've just mentioned was covered during my reg time. So I'm comfortable to say that whilst the playing field it's different, my experience already existed when I came into this role. I started off with discovery in clinical policy. So this was not quite quality of care at the time. So this was getting familiar with funding policy, medication devices, clinical pathways, clinical guidelines, and how you fund for some of the high-cost drugs, etc. Here, I think I used a lot of my research methodology. We explored health technology assessments, making funding decisions on drugs and devices. So my role also allowed me to work with the ministerial, an appointment to the ministerial EDL, Essential Drug List, bringing me closer to some of the public sector processes. And there are many opportunities at Discovery to support and to partner with the public sector health teams. I eventually grew into leading quality of care. And in my current role, I think I spend most of my time driving quality improvement by measurement and reporting. And then we use this in value-based contracting and value-based care. This entails developing and implementing quality programs, monitoring and evaluating. But I have to say that I'm very spoilt at Discovery in that I don't have to analyze my own data. So we have a very sophisticated actuarial and analytical team. But it does help to have the biostats background and epidemiology. And I often find myself interrogating the data and getting carried away with the data aspects. I think what's important to share is Discovery as a private organization is extremely data rich. It's, for want of a better word, an explosion of numbers. And I'm in awe of the potential that we have for short and long reports from a registrar perspective. I often feel that there isn't enough time and too much that can be explored, but definitely just, for those who are interested in numbers and the analytics, this is somewhere that you would have a lot of fun in terms of working. The role also has a huge strategic component. My portfolio sits under strategic risk management, and innovation is a key focus for us. Discovery offers a platform to think in all planes. I've never been limited in terms of innovation. I'm currently plugged into an improvement program driving readmission reduction for those who are at highest risk. And beyond just preventing people from returning for unplanned reasons, we were able to explore partnering with a international company using their digital tools to enhance this readmission prevention journey. And I've had this opportunity many times where you can explore things that you might be limited in terms of resource constraints within the public sector. And I know this is a unique advantage for working in private, but it's an opportunity for us to start also realizing that we must think outside the realms of, the box that we work in public sector. And I think, if I had to step out of my DH hat now and step into the public sector, there's a ton of experience that one can bring from private back into public, even within the limited resource constraints, to actually drive ideas that, would be different and actually be impactful. Sorry, I'm going on about my role at Discovery. I think just the last thing is, as part of the measuring and reporting part, we explore a lot of international methods, and we partner with international companies and organizations and universities. I've been quite involved in working on surveys for both patient experience and patient-reported outcomes. And the data that we get, we're always encouraged to present at conferences, at a variety of platforms. And again, I think the prep that we do from an MEd perspective in terms of the reports that we write, how we set up a study, how we get ethics approval, etc., all come into play in enhancing this kind of requirement within these companies that we can use. And I think lastly for me is just to say, beyond public health training, my experience at Discovery has enhanced my leadership and management skill development. So there's a lot of opportunity within Discovery to also grow in terms of management beyond healthcare management. And there's, courses offered at Gibbs and Henley, for example. So this is in a nutshell, just trying to explain how some of our training is used and is useful, and also how some of what we train to do grows within the current role.
Thanks, Geraldine. I think to your point firstly around the registrars and the potential for long and short reports, I do feel that, and I remember one of my professors when I was doing my MPH was talking about, and this was a clinician, we were doing some assignment, and he was talking about the private sector, and he said, the private sector is as you said as well, is a sort of hotbed of innovation and always looking for ways to do things better. And I think sometimes we miss that out in our training. We are not exposed to, and I understand the public sector is under-resourced, so we can't really sometimes roll out the same things, but we can take some of the thinking around it. And so
Absolutely.
I do feel like, as you say, I agree that, they, even for a short 6-month rotation, a registrar could really gain an insight into what I think a lot of us don't actually understand. I mean, I don't understand private sector mechanisms and how they go about doing certain things. And from the way you're describing, a lot of the work you're describing is something that similarly a clinical manager or somebody working in the quality department of a hospital may do. And it's just now in another context. But sometimes the way you think about the population is different. As you're saying, these are paying sort of clients, so you think about it in that way. But also, not to say that because people in the public sector we think about them as less so, but I think there is a different way of thinking around it when it is a health insurance context. But then also to the point around, and maybe you'll be snapped up now when NHI comes about, because, the NHI is, whatever people, think about it, it is aiming to bring public and private sectors to sort of one platform. And we really will need to understand both these sectors really well and where there are similarities and where there are differences so we can design for a robust system. So I do think, understanding the private sector is as an important part of being in public health. You don't need to delve into it, completely, but we have to have an understanding how private sector works, because again, the NHI is basically health insurance on a grand scale for the entire country. And so they're going to be designing many of the processes that are already in place in the private sector already. So I think that's a really great reflection, and I do hope that registrars do get exposed to the private sector in some way. I know there's a lot of planning that has to go into registrar rotations, but I do think that there definitely is value in that. So that's that's a really interesting lens on the private sector, and I think it's very interesting what you said about being sellouts, because there's many clinicians who work in the private sector as well.
Absolutely.
So I don't know why we have sort of a double standard around it. I mean, you can apply your skills sort of anywhere, whether it's health insurance or.
I think it's a lot to do with the fact that there's a misconception that public health medicine, like you explained earlier, has to do only with the public sector. And I think people need to step out and understand that if you look at international practice, public health medicine is rife worldwide, but it's only in SA that we have this huge contrast between a public sector and a private sector, right? So I think, there's a little bit of clarity that needs to be brought to the front of our mind when we look at what public health medicine is. So, yeah.
And I mean, and then to the point around, I think there's a lot of discussion that's going on in the fraternity at the moment around, for example, clinical care, because there are some people who feel that, we should be able to work clinically as well because they don't want to lose their clinical skills. Yeah. So I think, again, public health is a relatively younger specialty than many others. And so it's taking us some time. And the specialty will evolve as the health system evolves as well. Yes. And then, the training will have to change. If there is, the NHI comes about and there's this huge need for public health medicine specialists to understand both these sectors, then the training will have to evolve in order to accommodate that. But I think it is a discussion that definitely needs to be had within the fraternity around how to ensure that we have sight or insight into the different parts, whether it's NGOs, the public sector, the private sector, donor environment, etc. There's many working parts within the health system. So I've covered what I need. I think the last question that I have really is about your reflections for the next generation of whether they are, masters in public health or public health medicine specialists. And if you had to think back to sort of your journey and, when you were grappling with whether or not you should go into public health, what was some of the advice that you would have found useful at that point?
Sure. I think number one for me would be that public health medicine is not a 4-year registrar journey, it's lifelong. So one has to be committed to ongoing learning. And I think what I'm referring to here is it's a journey that requires you to not just be familiar with research as it comes out, but to also be committed to working hard and publishing your work and just being, making yourself visible. I'm amazed at how quickly the landscape changes. And if you don't stay abreast, I think you'll get left behind. So people going into public health need to have a kind of long-term commitment to the specialty. The second point for me, and this is a personal one because I've evolved over time, is network, network, network. I think there are no limits to networking. And this is not limited to local networking in SA only, it's international networking as well. I think the pandemic was a great example of how important it is to be connected worldwide. As a registrar, I shied away from networking. We go to conferences and I always felt like, I'm not working in that area. Do I need to know that person, etc.? And I've learned now with time, you'll be amazed with how everybody, it's a small circle and, all the worlds come together ever so often. So just build your relationships and network, network, network. I think the third one is something that you've touched on already, is be prepared to fight for some recognition. I think public health medicine is a relatively newer specialty compared to other more traditional clinical specialities. And we spend 4 years specializing like all other medicine specialists, but we often don't get, sufficient recognition for that. And so I think spend some time wondering if you are committed to the 4-year speciality or if perhaps the master's in public health is more appropriate for you. And I think it's an important point just to ponder on in terms of how you take the journey forward. And I think the last one is probably around, before you jump in, understand the registrar journey, understand where you're going. Public health medicine is very broad. There's analytics, biostats, epi, there's, numbers, but then we move on to health policy. There's quality improvement, which I'm passionate about. There's environmental health. Be familiar with all the different aspects and get a sense of where you want to go. And I think shadowing a registrar or a specialist or having, quite in-depth discussions with those already in the specialty would give you good insights to allow you to understand if this really is for you. And I think when you get into the journey, immerse yourself in the various experiences. You never know in terms of where you're going to land because of how broad this is. I definitely didn't set out to work in private. But, when I look back, I feel there are aspects I could have done more of during my reg time that would have strengthened my experience now. So knowing that sky's the limit, I think immerse yourselves and just get as much hands-on experience as you can.
Thanks, Jerry. I think that's a really great piece of advice, and a lot of, and partly the reason for this the series is that we do not have enough training platforms for the large interest in public health. And so, as you say, anything that you can do to sort of network, pick up skills online, do a short course, attend conferences, etc., will get you familiar with the space and hopefully allow you either to decide that you want to do this full time, or you may feel that what you've done is enough to just keep a peripheral interest in public health. So thank you for that. I think that's some really great advice for anyone who is watching out there. Before we close, any last words that you want to leave us with?
I think my last words would be that the more committed, dedicated people that we get into the speciality, the bigger the benefit, not just for us as a speciality, but for the South African healthcare system. So I think if the right people make the right decision, it's going to be amazing for us, irrespective of how our healthcare journey goes forward, with or without NHI. So I encourage all those who are keen to explore to actually give this the best shot.
Thank you, Jerry. That's a really great parting reflection. I think you are right. If we have the right amount of committed people in public health, we really can make the best of what we have in this country and really take the health system as a whole forward. So thank you so much for your time. I really do appreciate you taking the time out of your busy schedule to be here with us and to shed some light on the private sector, which again is, I think, not as well understood, especially the health insurance environment. So thank you so much, and we really appreciate it.
Thank you for having me.